Okay, go.
Hi, my name is Dr. Joe Papotto. I'm from Myrtle Beach, South Carolina, and we are here with Island Impact Ministries in Port-au-Prince, Haiti, a special earthquake relief project. So we have been in and around Port-au-Prince, probably within a 60-mile radius of the terribly destroyed city itself, and we have been doing mobile medical clinics, both dispensing medications, physical therapy, giving vitamins and counseling on nutrition, as well as encouraging the Haitian people in many other ways.
Can you tell me what type of cases were referred to the physical therapist?
Physical therapy played an essential role on our trip here to Port-au-Prince, especially since the earthquake has ravaged this poor nation. There have been a lot of patients with musculoskeletal injuries, such as simple as a strained low back to amputations of limbs. So we have seen physical therapists work with patients who have lost limbs, both upper and lower extremities, and also have met patients that are handicapped from birth who are dealing with prosthetic issues and maladjustments. We've had many cases where pieces of building have landed on patients and have hit them in the head or the shoulder or the neck or the back, and they're recovering from severe musculoskeletal injuries that go back to February or January, either climbing out of the rubble or helping remove loved ones from the rubble. So physical therapy has played a vital role and has received many consults from us physicians in dealing with these issues and with these maladies.
How do you feel that the mission would have been had there not been a physical therapist joining your team?
I think that there would have been a significant deficiency if there was not a physical therapist with us because of the uniqueness of this particular relief project. As I've mentioned, many musculoskeletal injuries, almost, I'd have to say 8 out of 10 cases, there was a musculoskeletal complaint. And just feeding them medications, which are only going to last a few days, is not going to give significant long-term relief to these patients. And having a physical therapist to demonstrate different exercises and stretches and doing splinting and wrapping of limbs and injured joints, along with the whole multitude of therapies at their disposal, was invaluable to our team.
The physical therapist had referred some unique cases that were found to different specialties. How do you feel that assisted in patient care? Like referred to an orthopedic surgeon or referred to an OBGYN.
Well, we've had some patients who have broken limbs or digits, which were obviously displaced fractures, which had to heal without splinting or without orthopedic correction. Certainly referrals to an orthopedic physician or team that could come from another country to help correct some of these disorders would be greatly appreciated by the Haitian people and would relieve them of chronic degenerative problems that they would have because of these injuries, such as broken hands and wrists, rotator cuff injuries of the shoulder, low back strains and sprains, cervical and lumbar disc disease and injuries.
Okay, and I know there has been several concerns about requesting for the general public to only donate to large organizations and to not donate to small organizations. How do you feel about those comments?
Well, I am kind of prejudiced, in my opinion, because I am a board member of Island Impact Ministries, and it is a small, newfound, incorporated ministry that is independent, and pretty much 80 cents out of the dollar goes back to the people that we help. There's a very low overhead. Small groups have much less bureaucratic processes to surf through. Therefore, they're much more quick to respond and play a very vital role in the assistance of earthquake relief, and also for repetitive visits to third world countries and helping with heal and mend the lives and the brokenness of people in these nations.
In closing, as a physician, what would you like to say to the physician community and the medical community regarding physical therapists providing the request for physical therapy relief in Haiti?
Physical therapy relief, especially when teamed with medical doctors and physicians, nurse practitioners, physician assistants, pharmacists, play an absolutely essential role, especially with something so unique as an earthquake disaster where you have a multitude of musculoskeletal problems that require the skill and the talent and the creativity of a physical therapist to employ special strategies and techniques and regimens for patients long after the team leaves. Also with the assist of appliances such as crutches and walkers and splints and prosthetic devices, which will help these people function again and be productive and earn a livelihood so they can continue to feed themselves and their families.
And lastly, can you tell us who your team member was that was the physical therapist with your group?
What is your last name?
Maglaya.
Maglaya, I'm sorry. My excellent physical therapist colleague was Cora
Maglaya.
I'm sorry, I just knew you by your first name.
All right. Thank you very much.
Thank you.